Hello, I'm Dr. J.D. Villegas. I'm a gynecologist and part of the staff of the Doctor Clinic in Macau. Today we're going to be talking about fibroids, a really common condition in women during the reproductive age. Welcome again, and let's get started. The uterus, or the womb, is a pear-shaped organ located in the lower part of the abdomen, the pelvic cavity in women. It is made up of smooth muscle in the outside and a really tiny little lining in the outside called the endometrium. The endometrial cavity is supposed to carry on the pregnancy, and when the women are not pregnant, they're going to be bleeding every month from that tissue, from the endometrium. The fibroids are benign, that means non-cancerous tumors located in the smooth muscle of the uterus. It's a really common condition and probably the most frequent cause of hysterectomy. They could be just little tiny tumors, or they could be several centimeters, and they can be from just one single tumor to a lot of them. It depends on the location and the size, that if they're going to cause symptoms or not. Many patients would have fibroids, but probably they would never have symptoms, and actually could maybe not realize that they have fibroids. According to some data, around 60% of Asian patients would have fibroids during their reproductive age. 70% of Latin and white Caucasian women, and around 80% of black African American women would have fibroids during their life. Fibroids are also called as myomas or leiomyomas because they proceed from the smooth muscle of the uterus, as I said, and they're formed basically from muscle and some fibrous tissue. They could be located anywhere in the uterus. If they're inside the endometrial cavity, they're called submucous fibroids. They could be inside the muscle. They're called intra or trans myometrial, and they could be in the outside of the uterus, and they're called subserous fibroids.